Hemorrhoids can be extremely painful and can affect our everyday lives and overall well-being. While some cases are treated with diet and medication, others require surgery to eliminate the injury. Dr. Magdi Alexander is known for his unsurpassed level of patient care and commitment to staying on the cutting edge of surgical technology. He is board certified by the American Board of Surgeons and a multiple recipient of both the America's Top Surgeons Award and the Patient's Choice Awards, among numerous other accolades. Dr. Alexander, thank you so much for being with us today.
Thank you for having me.
So we're talking about hemorrhoids today, which is something that nobody seems to want to talk about. Do you find that some of your patients are a little embarrassed to come in?
Yes, it's a very sensitive topic and a very embarrassing topic. So people tend to not want to come in. Unfortunately, because people try to ignore that problem, they might come in at a later stage, which may in fact make their therapy more intense.
That's really good to know. Now, how does somebody get a hemorrhoid?
Hemorrhoids can be produced by aging, they can be produced by medical diseases, they can be produced by pregnancy, they can be produced by, more commonly, constipation and chronic diarrhea.
And there are varying stages of hemorrhoids. Can you tell us a little bit about that? What are the stages?
Essentially, there is 4 stages. Okay. Stage 1 being the least intense, and stage 4 being the most intense. Stage 4 always requires surgical intervention, and that essentially is the traditional hemorrhoidectomy.
Okay.
Stage number 1 is the least intense and can be treated either with fiber supplements, topicals, and sitz baths, which is a soaking of one's bottom in warm water. Stage 2 and 3 is variable. There are multiple therapies for these stages, but essentially the vast majority of time either banding or procedure for prolapsed hemorrhoids is done for these stages.
What is banding?
Banding is where we take tiny rubber bands and put them on the largest of the hemorrhoids that essentially act like a tourniquet and choke off the hemorrhoids, as well as creating a tack point to elevate the hemorrhoid back to where they belong. These procedures are done in multiple stages and are done over weeks, and most people can drive themselves home. They have a very minimal pain sensation. It is done without anesthesia and is done physically in the office.
Oh, in your office, not an outpatient.
Right, it's not an operation. It's an office-based procedure. Then there is the procedure for prolapsed hemorrhoids, which is a circular pleat that's created while the patient is under general anesthesia, and it is done inside the rectum to avoid a lot of the sensitive nerves near the anal canal, and so that the intensity of the traditional hemorrhoidectomy is avoided.
Right, and that is a surgery.
It is an operation. It is definitely not as intense as the traditional hemorrhoidectomy, and the recovery time is significantly shorter.
Okay, so say we've waited too long to get the surgery done, and we're at the last stage.
Yes.
And it's really severe. Can you describe what would happen during a hemorrhoidectomy?
Yes, a standard hemorrhoidectomy essentially is done where you create 3 linear pleats within the rectal region to the anal area, and these linear pleats are sewn together and unfortunately divide a lot of the sensitive nerves in that area, and that's why the pain intensity is what it is. If you are fortunate enough to come in sooner, then you can avoid having this particular type of procedure and utilize either a banding procedure or procedure for prolapsed hemorrhoids, which are a lot better tolerated.
So the procedure for prolapsed hemorrhoids versus a hemorrhoidectomy, what is the recovery time for those?
A standard hemorrhoidectomy can have a recovery time from 2 weeks all the way up to 6 weeks. A procedure for prolapsed hemorrhoids is essentially a 7 to 10 day recovery time period. And banding, of course, is a day or 2.
So, as you were saying in the beginning, you want to come in as soon as possible.
You want to come in sooner, yes.
Right. Well, thank you so much for meeting with us today and answering our questions about this incredibly important subject that nobody wants to talk about.
I appreciate being here.
To learn more about hemorrhoid surgery and Dr. Alexander, visit www.socalhemorrhoid.com or to schedule a consultation, call 877-919-9997.